inform individuals at risk of necessary precautions by eating a balanced diet of vegetables. Good afternoon, members of Congress. My name is Danielle Wall. I am a health studies student at Texas Women's University. My overall mission is to inform individuals at risk of necessary precautions to take if known to have coronary heart disease. For example, maintaining a healthy diet by eating a balanced diet of vegetables, fruits, grains, and proteins. To also consider exercise. Physical exercise will improve the strength of the heart. Also locating the cause of sudden heart failure, whether due to lifestyle change that causes stressors in an individual's life or due to family history or genetic lineage. Today, I would like to discuss the conflict that arises from sudden cardiac arrest. Why maintaining a healthy heart is important. Due to this fact, I believe that the United States should create a Heart Health Day. Similar to Go Red, it is a day that will bring awareness and an initiative for people to maintain a healthy heart, become educated on what a healthy heart is. We can market this to the public by using this logo, which can be put on red shirts and passed out to the public to make more people aware of what an unhealthy heart can bring on: sudden cardiac arrest. Here is the overall scope of the problem. Cardiac arrest is the leading cause of death among adults in the United States. According to the CDC, approximately 300,000 occurs each year in the United States, and approximately 92% of the individuals die. A lot of the time, sudden cardiac arrest happens outside of a hospital setting and can be prevented. For example, if a person sees someone in need with chest pains, convulsing, or their breathing stops, they are most likely experiencing cardiac arrest. By taking simple steps, you can save someone's life. Number 1, rapid activation of EMS by calling 911. Rapid initiation of cardiopulmonary resuscitation, also known as CPR. 3, prompt application and use of an automatic external defibrillator, also known as an AED machine. This should be a requirement and should be placed in every public facility. 4, rapid delivery of an advanced life support by an EMS provider. And 5, early post-resuscitative care. By creating this day, this can bring awareness to the public of what to do in an emergency situation such as this one. According to the Sudden Cardiac Arrest Foundation, survival rates are higher among those who receive a chest compression alone by 10.2% versus a chest compression and a rescue breath, which is only 8.5%. The risk of sudden cardiac arrest increases with age and race. According to the Sudden Cardiac Arrest Foundation, rates of survival to 30 days after a hospital discharge are more than twice as poor for blacks as for whites, and survival among Hispanics are lower compared to whites. The risk is also higher if you have an underlying heart disease. The National Heart and Lung Blood Institution states men are 2 to 3 times more likely to have sudden cardiac arrest than women. Most of the time, sudden cardiac arrest is silent and can go undiagnosed. Thus, it is important to maintain a healthy heart. To decrease the likelihood of cardiac arrest, it is the job of the United States government to bring awareness to this issue so that we can bring forth this issue by establishing a Heart Health Day. The cardiac arrest can be caused by a number of impacts. One is a health impact on your body. It can be caused by an arrhythmia, also known as a ventricular fibrillation. This is an irregular heart rhythm due to an imbalance in the SA node or AB node, which is an electrical impulse that flows through the heart. Cardiac arrest can also cause a heart attack, coronary heart disease, or an enlarged heart. All of these have a big impact on the heart and can be deadly. It can also have an economic impact. These health impacts of cardiac arrest come at a major cost to our nation. Why should we fall victim to this disease when we can mobilize as a nation and fight cardiac arrest? According to Occupational Health and Safety, cardiac arrest cost Americans $2.2 billion in direct hospital costs. The indirect costs to the family and employer are multiples of this. These deaths cost the workplace in insurance premiums, loss of productivity, and actual and indirect costs, which can also affect the nation's economy as a whole. It can also affect national security. Heart disease can also affect military personnel as well as their combat in the field. Research studying veterans of the Vietnam War discovered service members who had been diagnosed with PTSD, also known as post-traumatic stress disorder, faced double the risk of developing heart disease than soldiers without mental health conditions. This study provides further evidence that PTSD and heart disease may affect physical health, says Dr. Gary H. Gibbon, Director of NIH, the National Heart, Lung, and Blood Institution. As you can see, heart conditions such as heart disease can affect anyone and affect active duty military men and our country. My recommendation is, in order to help decrease the amount of victims who are at risk for heart disease and cardiac arrest, Congress should pass a bill creating a Heart Health Day, July 22nd. We should have this day off and encourage individuals to learn one fact about their heart and what a healthy heart consists of. For instance, eating healthy diet, low sodium, and aim for a healthy weight by staying within your daily calorie needs. Encourage physical exercise and the public to visit their doctor or get a certain test done that can decrease the likelihood of cardiac arrest, such as using an EKG or using a cardiac MRI, which can show the flow of the blood pumping through the heart. We can benefit greatly by having this day because it will bring light to this problem in America that kills thousands of people a year. In the long run, it will increase our economic standing in our country, as well as help create a safer national security with healthier citizens and soldiers. Our country needs to focus on what will make our country a healthier people. This day will help Americans make better choices about their heart. Thank you again for this opportunity to bring awareness to heart health.